Yesterday, as legendary comedian Bob Hope is rushed to a Palm Springs area ER. The 97-year-old complaining of severe stomach pains and bleeding. But today, good news.
His vital signs are good. He's strong. He shook my hand this morning. He follows commands, and he's in a very stable, good condition.
Ironically, Hope was due to come into Eisenhower Medical Center yesterday here on Bob Hope Drive for a routine checkup. His declining health drawing the curtain on a dynamic career that began more than 60 years ago. Hope rose to stardom first as a radio host and then television and movies.
We're off on the road to Morocco.
More than 50 films later, the military's favorite performer is still entertaining, not cracking any one-liners just yet.
The Navy isn't sure how to best carry out its mission here in the Gulf. Why don't you just drain the sucker, then it'll be the Army's problem, huh?
He hasn't cracked any one-liners or done anything like that. But I understand yesterday he, after awakening, before his events, he was doing some clapping and a little bit of singing.
Hope will spend the next day or so in the intensive care unit here at the Eisenhower Medical Center. He's then expected to spend the next week in the hospital for observation and recovery. In Rancho Mirage, California, Juliet Huddy, Fox News.
Was he conscious the entire time?
Most of the time.
What typically causes this kind of a bleed?
No, this is a spontaneous type of event, and it occurs very commonly in the elderly. For his age, he is in very, very good shape and has done very, very well.
Is he facing any pain or discomfort?
No, no.
Has it required blood transfusions, though?
Yeah, he did require some blood transfusions. The main concern is what he came in with, which is bleeding, which is stopped. And the other concerns are just what any 97-year-old person would go through in an intensive care unit in a situation like this. But he's very stable and in real good shape.
Was he in a lot of pain when he came in?
No, no pain. Yeah.
How important was it to get him here quickly or to the hospital?
It's as important as anything, you know, if you're bleeding, you need to come in and get treated. Very important.
Was this brought on by the fact that he had been traveling for the last couple of weeks?
No, nothing to do with that at all.
You talked about his symptoms. We were told that he was complaining of the abdominal pain.
Really no pain at all.
So he was just discharging blood, and that's what the indication was?
Right, that's correct.
Anything else you know?
No, he's in good shape. He looks good and he's strong and he's otherwise very healthy. And this is a real common condition that's seen in people in their 60s, 70s, 80s, and 90s. I see it every day of the week at Eisenhower Medical Center, and he's fared it very, very well.
How's Marcel?
She's doing good. It's taken its toll on her, I think, just mentally. But she's very physically strong and very sharp woman, very intelligent, and has weathered this very, very well.
Any more procedures to do tomorrow, or is tomorrow just
The day of observation, really the observation for the rest of the week.
Why was he not brought here in the first place?
That was based on closest hospital. The condition was unsure when they got to his residence, and they just brought him to the closest facility.
Could this happen again?
Very unlikely. It could, but it's unlikely.
Have you treated Mr. Hope for a long time?
A couple of years. There's several physicians on staff here at Eisenhower who treat Mr. Hope, and I've been closely associated with him for at least 2 years.
Did he get his regular checkups too?
He gets regular checkups all the time. What's that?
Unusual from before.
No. He's been very healthy. He really hasn't needed doctors. So it's not been a big part of his life at all, as I think everybody knows.
Is it unusual for him to be down here this late in the season?
No, they generally, as far as I know, are still here. All right. Well, thank you.
Call you Bob Hope's internist.
Okay.
Is that good?
Well, that's correct. So.
And
Thank
Andy,
you.
Bob Hope does
Bye.
live part-time in Palm Springs in this beautiful home up here on the mountain. You can see it is just above El Cielo and Highway 111 in Palm Springs. Now, unquestionably, Bob Hope is the most famous celebrity still to call Palm Springs home, and he is extremely active in charitable causes around here, most notably Eisenhower Medical Center, where he actually donated the land many years ago. His wife was the president and chairman emeritus at Eisenhower, and tonight joining us is his doctor from Eisenhower Medical Center, Dr. Gary Annunziata. You've been treating him for the last 4 years. You've been in contact with his doctors today. What's your analysis of his situation?
I just got off the phone with Dr. Lee Kagan and spoke with him for about a half hour regarding Bob's condition, and he said that he suffered from pneumonia on Saturday night and has been placed on antibiotics and is improving quite a bit. Today they removed some tubes and they're getting him up in a chair, and he's looking much better.
How serious is this in comparison with the other things you've treated him for over the past 4 years?
Everything at that age is serious. However, in May of 2000 or June of 2000 when he came in, he had a very serious life-threatening gastrointestinal bleed. This is a different part of the body. Obviously, everybody's familiar with pneumonia. But in this situation, it is less serious, and he's improving at a faster rate.
Now, I understand you actually go out and see him every couple of weeks with his wife in Los Angeles in Toluca Lake. How was he the last time you saw him?
I saw Bob about 2 weeks ago, and he looked good. He was in good spirits, had lunch with him. He was getting physical therapy and getting up in the chair and laughs and occasionally says a little song.
He's walking, making jokes on his own.
He doesn't walk completely on his own, but with help he does.
All right, thank you very much, Dr. Gary Annunziata from Eisenhower Medical Center, Bob Hope's personal physician over the last 4 years. We will have much more on this story coming up later in the show, but for now, I'm Suzanne Pajot, live in Palm Springs for News Channel 3.
And continuing
John,
team coverage on our top story, Bob Hope's regular physician here in the desert remains in contact with doctors in Burbank. When he spoke exclusively to KSQ News Channel 3 this afternoon, he said the legend would pull through just fine.
And he told me that Bob is bouncing back very quickly, and the pneumonia is mild.
Gary Annunziata is Hope's doctor here in the Valley. Annunziata cared for Hope the last time the entertainer was in the hospital last year. You may remember the ailing Hope greeting reporters over a railing, putting everyone at ease over his condition. Annunziata says this isn't nearly as severe this time.
Compared to last May, he had a major gastrointestinal hemorrhage, which at that time was more life-threatening. Considering this is a mild pneumonia, this is less life-threatening.
Bob Hope has been a fixture in the desert for decades. His golf tournament has raised millions for Eisenhower Medical Center and many other causes. While he is showing his age at 98, the comedian's doctor says that when he saw Hope just 2 weeks ago, his sense of humor was still very much alive.
2 weeks ago, both Bob and Dolores looked very well, and he was eating up 3 times a day. He gets a massage, physical therapy, and when I speak to him loud in his ears, he'll laugh and even smile and tell a joke occasionally.
And here in the Valley, there are many fans hoping Bob Hope has many more jokes.
His doctor was optimistic earlier tonight.
And he's resting comfortably. He's in very stable condition, and we anticipate a full recovery.
But when I asked how his spirits were, the doctor was not as encouraging.
Right now, it's, he's in a hospital setting. It's an acute situation, real hard to assess that.
Still, Annunziata, who's been treating Hope for years, says all things considered,
for his age, he is in very, very good shape and has done very, very well.
Back here live outside Eisenhower Medical Center in the emergency entrance to the hospital, where doctors say Hope should be kept here for about a week. All things considered, they said, for his age and the seriousness of his condition, that's about the average stay. They said right.
He's in very stable condition, and we anticipate a full recovery.
For Bob Hope, the day began with alarming indications of trouble. Stomach pain and gastrointestinal bleeding led family to call for an ambulance. Hope was rushed to Desert Regional Medical Center, where he was stabilized. He then transferred to Eisenhower Medical Center in Rancho Mirage, where doctors say he has been comfortable and awake.
This is a spontaneous event that occurs in older people. Non-life-threatening, very common condition. Generally occurs acutely and unexpectedly, and generally not life-threatening.
Hospital officials say that Hope's wife Dolores and daughter Linda are optimistic.
He's doing good. He's very stable. His heart's good, his lungs good, kidneys are good, and he's resting comfortably. He's in very stable condition, and we anticipate a full recovery. And he's in no acute danger right now. It's excellent. He is very strong. His pulse is normal, his blood pressure is normal, his kidneys and heart and lungs function very well.
Did he have a blood transfusion?
Yeah, as we said yesterday, he did receive a blood transfusion. I don't know the total amount of units. I haven't gone through and counted that up, but
Is that unusual in a case like this?
no, no.
Doctor, does he have any?
Is he still in the critical care unit, and what's the timetable?
It's daily assessment by me. If I see him and he looks to be more stable, then we'll transfer him up. But it'll be through today, and we'll reevaluate him in the morning.
Are there any other noticeable ailments at this time?
No,
Is he a sign of something else that is wrong?
no.
It's just an individual.
This happens to people all the time, and then when they recover, they go on as they did before the event. Well, I mean, you assign conditions based on vital signs and pulse and blood pressure, and he was critical, but a lot of that, after retrospect looks, you have to assume critical or the worst condition and then assess as you go along. But, you have a 97-year-old male who's bleeding, you take all precautions, no matter who it is. Very stable overnight, yeah. She's by his side all the time. I think we'd need a crowbar to get her away from him. She's doing very good. Just the mental anxiety of this event, but very stable, good spirits, and happy, but very concerned about Mr. Hope.
Do we know if he had any history of hepatitis in his past?
Never. And that's typical.
Has he reacted at all to the reaction from the public and the media?
No, that's been kept away from him. There's no TVs on in his room at this time.
So he doesn't know about what's going on out here?
No. Well, it's mostly observation and recovery. Okay. Any other questions? I'm sure there is, but...
Any other visitors, doctor, besides Mrs. Hope?
There's the hospital's received hundreds of faxes from people all over the world, well-wishers to Mr. Hope, and phone calls are coming in by the dozens. We're talking about probably 2:30 this afternoon or so, somewhere around there.
Doc, is there any concern about a prolonged hospital stay at that age? Many people go into the hospital and end up getting something which they didn't come into it with?
I think, as Mr. Ward's press secretary, or Mr. Ward, or Ward, his press secretary, said this morning, he's 97. And at 97, anything can happen. But again, he's very strong and otherwise in very, very good shape.
But it is, in my point, Doc, keeping him longer in a place where there are many other germs. Is that a concern of yours?
Always a concern, and that's why we very carefully assess the length of stay and the necessity for stay and minimize anything that doesn't have to be done. Okay, thank you. We'll see you back at 2:30.
Okay, and that was a live press conference at Eisenhower Medical
Dr. Gary
Center.
Annunziata of the Eisenhower Regional Medical Center is speaking right now. Bob Hope is in the critical care unit there. Let's listen to Dr. Annunziata.
Warning signs would be the onset of bleeding or any other problem related to being in the hospital in the ICU. And that's part of seeing him 1 or 2 times a day while he's there. and monitoring those things and doing laboratory tests and things like that.
While Dr. Annunziata answers a question, he did say that Bob Hope is in stable condition and is being observed, and there is no really dramatic update in his condition. He's taking questions. Dr. Annunziata, let's listen some more.
That are not cancerous or tumorous, and one is called diverticular bleeding, and the second one is called angiodysplasia. We shorten it and call it AVM. And those are common causes of bleeding that present like this in people in their 70s and 80s and 90s and beyond. The cause is not really known. Sometimes these angiodysplasia can be associated with heart valve problems and things like that. The diverticuli are very common. Almost everybody after age 60 has them. Only 5% of people who have them ever develop a symptom or bleed from them. So 95% never have anything related to that. Stability of vital signs.